video. Thank you very much for joining us in this session. I would like to thank the scientific community for the invitation to talk about fat diet. What's fun and fat? I'm Dr. Ian McLaren. I am a doctor. These are my disclosures. And for this session, our objectives are to discuss the more popular fat diets, particularly the intermittent fasting and ketogenic diet, and we try to review dietary interventions for weight loss and improve health outcomes. We are well aware of the growing prevalence of metabolic disorders, which include, of course, diabetes, obesity, and hypertension. And as a consequence, because medical nutrition therapy is part of treatment of these conditions, people are more susceptible to adopt various fad diets that claim to aid in losing weight very fast. As stated in the CDC's healthy weight, it is not a diet, but it should be a lifestyle. With that being said, the CDC likewise defines fad diet as any weight loss plan that promises quick results, and it's usually a temporary nutritional change. A fad diet is generally popular for a brief period or long time period without being a standard dietary recommendation per se. Fad diets often promise inflated and or quick results, such as significant weight loss and or health benefits. They also often are touted as the only way, requiring little effort or based upon pseudoscience. Unfortunately, such promotion may and frequently does hinder education about the overall diet and personalized variations or preferences, along with other critical lifestyle changes necessary for sustained health benefits. This is why it is very important to take note of what we call red flags. The Cleveland Clinic suggests that fat diets tend to have the following characteristics. One, they have recommendations that promise a quick fix. We claims that sound too good to be true. We have simplistic conclusions drawn from a complex study, recommendations based on a single study. We have dramatic statements that are refuted by reputable scientific organizations. They list good and bad foods, recommendations made to help sell a product. We have recommendations based on studies published without peer review. We have recommendations from studies that ignore differences among individuals or groups, and the elimination of one or more of the 5 good groups, meaning fruits, vegetables, grains, protein foods, and dairy. So I have here a list of different or of what is the history of fad diets. And fad diets are known for centuries, and since ancient time, it was reported that the Greeks and the Romans had used them. However, at that time, it was more about a healthy and active lifestyle. As you can see in the list, in the Victorian period, they actually adopted fad diets. And you can see here, Lord Byron introduced the vinegar and the water diet in 1820. A century later, quite surprisingly, you will see here the Lucky Strike cigarette diet. Again, one of the more notorious diet, wherein the Lucky Strike Cigarette Company launched the known cigarette diet based on the appetite suppressing effects of nicotine. So you also see here in the 1930s and eventually the 1950s, we have what we call the Grapefruit Diet, as well as the Cabbage Soup Diet. We also have in the 1960s, the Weight Watchers. It was founded by Jane Nidbeck. We also have the Sleeping Beauty Diet, which is known because it consisted of sedation. Eventually, as you go down the list, you have the Slim Fast, which is considered as a super diet that involves having shakes for breakfast and for lunch. We also have the well-known Atkins Diet, the Zone Diet, and what we call an Atkins Light Diet, or what we call the South Beach Diet, is introduced, and even the Hcg Diet, using a fertility drug together with 500 to 800 kilocalorie a day diet. Okay, so that shows you a lot of what has happened about fat diets. So let's go specifically for some of those. The Grapefruit Diet, which is a very low calorie, low carbohydrate. A typical meal plan for this diet includes breakfast, which has half a grapefruit or 200 ml of unsweetened grapefruit juice, a cup of tea or black coffee, and 2 eggs and 2 slices of bacon. Lunch and dinner will contain half of a grapefruit or 200 ml of unsweetened grapefruit, 200 grams of meat, poultry or fish cooked as desired, with unlimited non-starchy vegetables, black coffee or tea. Some versions of the diet allow for additional 200 ml vegetable juice or skim milk to be consumed during the day. This is basically a very low-calorie diet, low-carbohydrate diet, and depending on the version, it may provide as little as 8,000 kilocalories per day. The main reason for the grapefruit diet is that we think that there are specific molecules or specific contents of the grapefruit that will elicit weight loss. The cabbage soup diet, on the other hand, is a 7-day meal plan of unrestricted cabbage soup together with combinations of foods that are claimed to facilitate and maximize weight loss. As you can see in the list, for day 1, we have cabbage soup plus raw fruit but not bananas. Day 2, of course, cabbage soup plus raw or cooked vegetables but not potatoes. And day 3, we have raw fruit and vegetables but not bananas or potatoes. So basically, for the 7-day meal plan, we have cabbage soup with different additional requirements. So day 1 to 3, basically, we have less than 1,000 kilocalories per day caloric intake. Day 4 and 7, about 1,000 or slightly more. And day 5 and 6, we have more than 1,200 kilocalories in intake. Though exercise is discouraged on this diet, a weight loss of 4.5 kilograms per week or more is promised. So another notorious diet plan is what we call the Hcg diet. So this is using a very low calorie diet of 500 kilocalories per day together with daily Hcg injections. So this was formulated by an endocrinologist, Hcg Simmons, who treated patients with this with chronic syndrome, which is characterized by adiposogenital dystrophy, a rare metabolic disease associated with hypothalamic tumors, which may increase appetite and depress gonadotropin secretion. He noted that with intramuscular injections of human Hcg, the treatment resulted in reduction in fat mass and a change in fat distribution, even in cases where weight loss was not achieved. So as you can see here, menu plans typically divided into 2 meals, lunch or dinner, 100 grams of low-fat protein, 1 serving of a vegetable, 1 fruit, and a serving of starch. Remember that Hcg has not been approved by the US FDA for weight loss, so that there were non-Hcg preparations that were also meant to induce weight loss, which included African mango, astragalus fruit, arginine and glutamine, carnitine, vitamin B12, and magnesium. So if we look at the different types of fad diets based on the British Dietetic Association in 2014, you have here a list of the different dietary types and the known diet types. So basically you have low carbohydrate diet, very low, extremely low carbohydrate diet, combination therapies, which are formula-based, like your Slim Fast, those which are pre-measured diets, like your Jelly Craig, those that could have fluid or liquid diets, which is the Master Cleanse, and the high-fat ketogenic diet that we'll be discussing in detail. So to sum up most of those fad diets, you will see here the types of diet, their characteristics, the components, and the health consequences. So the high-protein diets, which included Atkins and Dukan diet, have less than 50 grams of carbohydrate per day with consumption of animal protein, and carb-free high-in-protein diets structured in 4 different phases, respectively. You see there that the health consequences included water imbalance, ketosis, appetite suppression, renal dysfunction, nausea, low performance capacity, dehydration, and osteoporosis. The high-carbohydrate, low-fat diet, an example of which is the Pritikin diet. It is a low-fat, low-calorie, plant-based diet, mainly fruits and vegetables, fats not exceeding 10% of the total daily calories. So the health consequences include inadequate intake of good quality protein, vitamin and mineral deficiencies, and coronary heart disease. The low carbohydrate, high fat diet, which includes your ketogenic diet, is characterized by high fat, adequate protein, and lower carbohydrate diet. We should be discussing in detail later. This, however, can induce acidosis, hypoglycemia, gastrointestinal distress, dehydration, lethargy, kidney stones, dyslipidemia, and decreased bone density. There are combination diet, like the zone diet, in hormonal control, by a specific ratio of protein, carbohydrate, fat intake is induced. However, there is concomitant vitamin and mineral deficiencies. There's the Grapefruit Diet that we talked about, and formula diet, the slim fast diet, wherein dietary supplement based on a drinkable meal replacement once or twice a day, each containing 240 kilocalories. However, low nutritional intake, low energy, weakness, and risk for eating disorders may occur in these kinds of fad diet. So remember that dietary interventions for weight loss and health would include either alteration in caloric intake or alteration in meal planning. So we'll go through 2 examples of these conditions. And in my search of Google Trend, as you can see in this table, wherein I looked at 3 concepts: healthy eating, intermittent fasting, and ketogenic diet, you will see that versus healthy eating in blue, ketogenic diet in yellow, and intermittent fasting in red has shown very much interest with regards to Google Trends in the Philippines for the past 5 years. So we'll be for the past 5 years. So we'll be discussing in detail these 2 patterns of eating or fad diets. So just a short review. This is an illustration showing to us the patterns of daily and weekly food consumption. So these are daily food consumption patterns on top, and the weekly consumption pattern in the side of the table, in the side of the slide. So regular meal is characterized by 3 meals and snacks, as represented by A. So black in night, blue morning. Okay, and you see regular meals is represented in red, small meals in smaller red circle, and snacks in yellow. So this is regular meal, 3 meals and snacks. So examples of time-restricted feeding is characterized by letter B, wherein you have 3 meals consumed during the day only. During the day only. Section C, or initiation C, is characterized by 2 meals with no breakfast, also being taken in the day, and 3 small meals, as represented by D, also meals consumed during the day only. And of course, a complete fast, wherein you do not take anything during the day. So those are daily food consumption patterns. However, there are several weekly consumption food patterns, wherein, like, for example, letter E, you may have complete fast at alternate days, as represented by here, or alternating fasting, as represented by B. So this shows you the combination of daily and weekly food consumption. So basically, dietary regimens with variations in meal size, frequency, and circadian timing may be divided into caloric restrictions, time-restricted feeding or TRF, and intermittent energy restriction or IER that we'll be discussing again in detail. Basically, most of the fad diets that I've mentioned are caloric restriction diets. So just for definition, so that we're at the same foot, caloric restriction means that daily reduction by 15 to 40% of calorie intake without malnutrition. This is how we define caloric restriction. So that macronutrient balance may be standard. However, total calorie requirement, as I've said, is reduced. Feeding time and fasting time may just be the same. Time-restricted feeding means that daily food consumption is restricted to 4 to 12-hour window. Okay, you have a standard, okay, follows a standard macronutrient balance, or you may have some alteration or obesogenic, okay, percentage of time-restricted feeding. So again, you see that most of the feeding period is shorter. So intermittent periodic fasting or intermittent fasting, as described as IF or PF or periodic fasting, specifically defined as alternation of 24-hour fasting or very low calories, 25% of energy needs with a 24-hour ad libitum eating period. Okay? While periodic fasting is 1 to 2 days fasting or very low calories, followed by a 5 day ad libitum eating pattern. So this is what we call the 5-2 pattern. So 2 days of fasting and 5 days of non-fasting. There's also a fasting mimicking diet or FMD, wherein there is reduced caloric intake by as much as 30% of your energy needs for 5 consecutive days before returning to normal eating cycles of FMD once a month or every 3 to 4 months per year. Okay, so those are the different eating patterns. And these interventions has been noted to be beneficial or have expected effects in the body. So with energy consumption, either reduction in total intake or exposure to food or time-related feeding, you will see that these are the expected effect in blood, in the liver, in the intestines, in skeletal muscles, in the brain, in the cardiovascular system, in the pancreas, in the adipose. So basically, you have catabolic conditions or metabolism. So you have ketone body formation, okay, you have increased insulin sensitivity, you have increased hunger response, etc., and lipolysis. So how about time-restricted feeding? Okay, time-restricted feeding or TR. Okay. So in here, you have involvement of limiting daily intake of food and caloric beverage to a 4 to 6 hour time period. So this best illustrates a time-restricted feeding. So compared to normal, for those with a bigger window, eating over an extended window of time and or frequent change in daily eating window is associated with obesity, cardiovascular disease, liver disease, and low sleep and quality of life. Versus your time-restricted feeding, where eating is consistently restricted to less than 12-hour window. So this is associated with a reduction in obesity, cardiometabolic disease, liver disease, and better sleep and quality of life. So this best illustrates the beneficial effects of time-restricted feeding. As you can see the window here. So there is increased fasting, there is reduced eating. So time shift of postprandial hormones and nutrients will favor lipid mobilization. So this will mean there is body weight reduction, reduction in fat mass, blood glucose, reduction in insulin resistance. Impaired beta cell function is also reduced together with fatty acid oxidation. Impaired is reduced. So there is a general benefit with regards to liver fat, inflammation, oxidative stress, blood pressure, and sleep quality. So this slide shows to us the schematic or ideal TRE intervention. Okay, so when you have 8 hours of time in bed, so when do you start your patient? When do you start eating? So the recommendation is to avoid food for at least 1 hour after waking up, so that the window period is about 10 hours of eating. So you may have light to moderate outdoor exercise for 30 minutes, making sure that 2 to 3 hours before bedtime, you avoid bright light and you avoid calories. Use your time in bed as a guide. So in doing this schematic intervention, use your time in bed as a guide to determine the best 10-hour eating window. And the window should start 1 hour after waking up and then 2 hours or more before bedtime. And the evidence, there are evidence of benefit as well as non-harm or lack of benefit in some of the studies on time-restricted eating. So varied results, not so very consistent. How about with intermittent energy restriction? So this is best defined or best defined as intermittent fasting. So there are periods of voluntary abstinence from food and drink. So there are different types of intermittent fasting regimens. Okay, so you have your complete alternate day fasting. So it involves alternating fasting days, so no energy containing food or beverages consumed, with eating days. So very simple to understand. We have modified fasting regimens, so you allow consumptions of 20 to 25% of energy needs on scheduled fasting days, and the basis for the popular 5-2 diet. So 5 days and 2 days, which involves severely energy restricted for 2 non-consecutive days per week, and ad libitum eating for the other 5 days. So we discussed about time-restricted feeding. So there are religious fasting like Ramadan and other religious fasts that may fall into intermittent fasting. So the rationale for intermittent fasting is that it flips the metabolic switch, the body's preferential shift from utilization of glucose from glycogenolysis to fatty acid and fatty acid-derived ketones. Ketones appear to be the preferred fuel for the brain and the body during periods of fasting and extended exercise. And this switch represents a shift from lipid synthesis and fat storage to mobilization in the form of fatty acids and ketones. And the switch occurs in third phase of fasting. So between 12 to 36 hours after cessation of food consumption. This is dependent, of course, on the liver glycogen content. So this illustration shows to us the cellular and molecular mechanisms that happen in periods of intermittent fasting and periods of recovery. This is what we call the metabolic switch. So that you will be actually utilizing more of the catabolic processes versus the anabolic processes. So this slide shows us the mechanisms of action of intermittent energy restriction, either total or partial intermittent energy restriction, effects on the adiposity, on glucose metabolism, on negative energy balance, on vascular function, lipids, and stress resistance. So basically, the effects and major responses to various organs to intermittent fasting is that you have ketosis, reduce glucose, glycogen depletion, improve cognition, reduce blood pressure, lipolysis, and increase insulin sensitivity. So these are 6 of the more popular intermittent fasting schedules that you may be familiar with. The 16-8 diet, so you have eating only at 8 hours and fasting at 16 hours. The 5-2 methods, we have 5 eating days and complete fasting for 2 days. We have the alternate day fasting, the eat, stop, eat diet, the 14-10, which is a variation of the 16-8, and the warrior diet. So I have here slides representing the 16-8 diet, so 16 hours of fasting and 8 hours of eating. We also have the 5-2 diet, wherein there is dietary restrictions of non-consecutive days in a week. It's represented here by this table. We have, of course, very easy to understand the alternate day fasting, the eat, stop, eat diet, which is a variation of the 5-2 diet, the 14-10, which is a variation of the 18-6 diet, the warrior diet, where it has shorter time for eating, and all of these intermittent fasting diet have corresponding effects with regards to lipid profile, blood pressure, glucose, and insulin, insulin resistance, risk for coronary heart disease parameters, and with regards to both intermittent and intermittent fasting. So the data are mostly beneficial, but again, not very consistent. So for you to incorporate intermittent fasting into healthcare practice, then we have to remember that you may do this this way. You may have prescriptions in 1 month, in 2 months, in 3 months, and in 4 months. So that it may be incorporated in your lifestyle. So that's intermittent fasting. The second most popular fasting regimen or fad diet is ketogenic diet, which generally refers to a diet that is very low in carbohydrate, modest in protein, and high in fat. So this mix of fuels aims to induce ketosis, or the production of ketone bodies that serve as an alternate energy source for neurons and other cell types that cannot directly metabolize fatty acids. So urinary ketones are usually used to indicate dietary adherence. So there are several forms of ketogenic diet. So you have the standard American diet. If you compare that to your therapeutic ketogenic diet and your standard ketogenic diet. So it's again, this is a high-fat, low-carbohydrate diet. So you see the difference between the two. The therapeutic ketogenic diet is typically used in epilepsy and cancer treatment. So if you compare Okay, the ketogenic food pyramid versus the recommended dietary food pyramid, you again see the low carbohydrate and the high fat, okay, constituent of the ketogenic diet. Listed here are the potential benefits of the ketogenic diet for cancer, for epigenome, for the microbiome, to diabetes, to weight loss, and cardiovascular disease. And there's data to suggest that there may be improvement with regards to weight, with regards to triglycerol, with regards to HDL cholesterol and LDL cholesterol, and even on systolic and diastolic blood pressure with ketogenic diet. However, the Philippine Heart Association, together with the Philippine Society of Endocrinology, Diabetes and Metabolism, and the Dietetics and Nutrition Group in the Philippines, actually came up with the Philippine consensus on the use of ketogenic diet and intermittent fasting on adults for weight reduction. This recommendation and consensus statement was published in the Philippine Journal of Internal Medicine in 2020. So in this document, for which I had the opportunity to participate, looked at intermittent fasting, which was defined as an interventional strategy in which individuals are subjected to various periods of fasting. So approach to weight loss involves short periods of substantial energy restriction interspersed with normal eating. So this is also known as your intermittent energy restriction. So in the document, we reviewed particularly alternate day fasting, modified fasting regimen, time-restricted fasting, and periodic fasting. So with regards to the recommendations, particularly for different patient population, for overweight or obese adults without established ASCVD, intermittent fasting, particularly alternate fasting and modified fasting regimen, may be used as a weight loss strategy for 6 to 12 months. Recommendations, on the other hand, for adults with type 2 diabetes mellitus, intermittent fasting is not recommended for weight reduction, and for patients using insulin or insulin secretagogues, intermittent fasting is not recommended due to the risk of hypoglycemia, and it's also not recommended for weight reduction. For the third patient population, for adults who are overweight or obese with established HCVD, it showed that there are no clinical controlled trials to support the use of intermittent fasting for weight reduction in this patient population. And for obese and overweight adults with established ASCVD, it is not recommended for weight reduction. We also reviewed some of the known adverse effects of intermittent fasting in this consensus statement. So headache, reduced energy levels, feeling cold, constipation, lightheadedness, halitosis, preoccupation with food, mood swings, and lack of concentration. We also reviewed, of course, ketogenic diet. In the document, we wrote there it's a low carbohydrate and high fat content diet, and was first used by Dr. Russell Wilder from the Mayo Clinic for treatment of epilepsy in 1921 with late weight loss as an observed side effect. So there are types of ketogenic diet, as I said earlier. You have the classical, defined as less than 130 grams of carbohydrates per day, or less than 26% of caloric intake by the American Diabetes Association based on a 2,000 kilocalorie day diet. You have a very low carbohydrate ketogenic diet, which is composed of 50 to 60 grams of carbohydrate, or less than 10% of the 2,000 kilocalorie diet, whether or not ketosis occurs. So the true ketogenic diet particularly highlights use of unsaturated fats, like your monounsaturated, polyunsaturated, omega-3 fatty acids versus your trans fatty acids and your saturated fat. So based on the consensus statement, again, for overweight or obese adults without established cardiovascular disease, ketogenic diet for 12 to 24 months has been shown to be associated with weight reduction, though currently there is not enough evidence on the effect of ketogenic diet on normal weight and overweight individuals on weight reduction. For adult patients with diabetes, there are very few small RCTs and observational clinical outcome studies to support ketogenic diet for weight reduction. So for adults with diabetes, it is not recommended for weight reduction. For those patients on insulin and secretagogues, it is not recommended due to the risk for hypoglycemia. Not recommended as well for weight reduction, and even for those patients on SGLT2 inhibitor because of the added risk for diabetic ketoacidosis. And similar to the third patient population, those adults who are overweight or obese with established ACVD, there are no clinical evidence on KD, on ketogenic diet, on weight reduction. However, there are population studies that show long-term low carbohydrate intake associated with higher mortality. And for this high-risk population, ketogenic diet is not recommended. We also identified some of the short-term adverse events as well as the long-term adverse events of ketogenic diet. So meal timing and frequency implications for cardiovascular disease prevention, because this is what we've been talking about, timing and frequency, or your TRF. So the American Heart Association actually came up with an intention to approach eating. So in here, they say that to develop an intentional approach to eating that focuses on the timing and frequency of meals and snacks as the basis of healthier lifestyle and improved factor management. It's important that we do follow intentional approach to eating. The American Association of Clinical Endocrinologists talk about the different dietary plans in this Venn diagram. And we learned earlier the pros and cons of the different types of diet. You also have to remember, again, based on the AAC, that there are fads to pretty much ignore. So anything promoting detoxification, the alkaline diet, the blood type diet, cabbage and fruit diet, Hcg diet, and the bulletproof coffee diet. So remember that the general advice for weight loss is to lose weight by eating well-balanced diet in appropriate amounts proportionate to your needs and at physiological intervals, coupled with regular and appropriate physical activity. Consult your physician and registered dietitian before engaging in any weight loss diet program. So with that, thank you very much for your attention.